Hey, welcome everyone to Scrubs and Software. I am super excited about this episode, finally doing one on UpToDate's Expert AI. Before I jump in, just want to say thanks for all the support, comments, suggestions. I'm recording this the week before Health. I know I've got lots of meetings and exciting people to meet next week, so really looking forward to that. If you happen to be there, I know the UpToDate folks are actually going to be there, but anyone else that is going to be there would love to connect and chat about anything AI related, tech related, any projects you may be working on. But when a few weeks ago I found out that UpToDate was having their release of their own AI platform and tool, obviously there's been a bunch of other ones out there, I was super excited. And the reason for it's simple, right? All of us as medical students, residents, currently, we've always turned to UpToDate to look stuff up. There's just so much uncertainty, so many things to remember. We're not going to remember certain pathways. I personally turn to UpToDate as kind of the, for lack of a better word, gold standard for things to look up at. So I have had offhanded conversations with friends and colleagues, last 6 months, last year, about, hey, it'd be really nice if there was a large language model, searchable AI tool for UpToDate, and now it exists. So it's called Expert AI. I had a call with some of their team members to kind of explain it to me and the thought process that went behind it. And the thing that stuck out to me was they didn't want to rush to market with a product just to say, hey, we have something. They put in a lot of hours and a lot of testing and a lot of trying to break the system to make sure that when they released it, that it was something that was going to stand up to the UpToDate name. And I've been playing around with it, and I think it really does. I use UpToDate quite frequently. This is an account they set up for me where the AI feature is enabled, but if you look at the CME counter on my primary account that I use within my hospital system, I get tons of CME. It's one of my primary sources of CME. And so it's something I turn to quite frequently. I don't think they've released the AI feature into every account yet. I know I was testing that one within my hospital system. It wasn't active, but they are slowly releasing it and gradually rolling it out. So this is the UpToDate homepage. And when you kind of show up, if it's enabled, you'll see kind of this Expert AI little tab, and it'll say get help with a case, ask a question. So I'm just going to click on that. And so this is kind of what pops up, built for clinicians by clinicians. And here's some example questions, right? What is the risk of bleeding from oral anticoagulants? What is the differential diagnosis of fever and splenomegaly? So the question I'm going to ask it is, things where you're a bit uncertain, right? A 32-day-old full-term infant is brought to the ER, they have a fever. And it's a case that we quite frequently encounter. And it's one of those situations where you're like, oh boy, am I going to have to do a full workup and do a spinal tap on this baby? And what is the exact cutoff? Is it 30 days? Is it 60 days? Maybe you don't work in a center where you see a bunch of pediatric patients and you're curious. So this is the exact type of thing that I would probably ask in a real life situation. So we'll ask it to search that. The things that stood out to me from my call with them was that they don't want this to be something that becomes a crutch. They still want the teaching aspect of what we all do in medicine to still be there. And one of the main things, as you'll kind of see as it pops up here, is a alert where it kind of shares what are the assumptions the AI is making. And for me, a lot of times I found that it'll say something like, I'm assuming this is a healthy patient with no medical history. And so let's actually look at this, what the assumption is here. So it's saying this patient is a 32-day-old full-term infant presenting to the ER with a confirmed fever of 101.8. I am assuming the fever was measured by a reliable method, right? So there you go. Is this fever, was it a rectal temperature? Was it a oral temperature taken at home? So this is assuming that information is reliable. And in the back of my mind, it's going to make me think, how did the nurse take it? What was it accurate? So let's keep going. So it was measured by a reliable method, and the infant is otherwise stable unless otherwise specified, right? So it's assuming the infant has stable vital signs. This answer will focus on the initial evaluation of a febrile infant aged 29 to 90 days, emphasizing identification of serious bacterial and viral infections and outlining the recommended diagnostic approach. So a lot of the other tools that are similar to this out there, they don't have this statement. And so they give you an answer with a lot of confidence. And we are now learning that clinicians and the general public alike fall for these answers, even if they are wrong, because of the confidence with which it acts. And I think that's true in life, right? If a leader or a politician or anyone says something with extreme confidence, or a friend, we believe it because of that confidence. Same goes here. When AI, LLM gives you some answer with extreme confidence, we tend to believe it, and studies are starting to show that. And so this kind of gives you this case alert and the assumptions where it's saying, hey, I'm assuming this, right? I am fallible. I may not have all the information. I'm going to give you an answer in what I think is right and what I think you should do, but I am assuming this. There's also this case alert up here. It says AI can provide general information, but may not fully account for clinical nuance or patient-specific factors, may contain errors. Think critically, bolded. A lot of students are going to be using this, and I think this is a good reminder for all of us, but students as well, right? When a student searches something up, it may be easy to say, hey, let me just see what the answer is, but it's kind of giving this upfront, and it's hard to ignore, and I think it's very important, especially as we have these conversations about de-skilling and how we may be not as smart now that these tools are out there. I think this is something that is really taking that into account. So steps in evaluation of a febrile infant, it's saying confirmed fever, history, physical exam, and it's telling me exactly what to look for, things like perfusion, respiratory status, signs of focal infection, gives me a few. Once again, I love how each of these is labeled, so if you click on it, it's going to open up another tab and take me exactly to the part where it's getting this from, and this is what we're very used to seeing to begin with. And so I love that. It's kind of giving you assess appearance, ancillary status, and then the lab test that you should get. So urine, blood cultures, CSF studies. I'm going to have to do the LP, unfortunately. Inflammatory markers, other studies. Once again, I love how it's kind of building out this chart for me. This is when they were kind of showing me this tool. A lot of times these charts are actually custom built. So they're not, just copying and pasting them from something else that is on UpToDate, but it's built exactly for this question that I'm asking. And then it kind of summarizes the key points down here. I also love kind of the learn more section where it is saying, like, what if the infant is ill appearing or has abnormal signs? So in this situation, we had said that the infant was, well appearing, non-toxic, but what if they are ill appearing? And so then you can click on that, and once again, it's going to generate a new response, take everything you had given it, and then add the ill appearing aspect of it. The other thing I loved is, once again, and I actually learned this, I didn't know this, anytime you submit submit feedback, or if there's an issue, that actually goes to an actual clinician that reviews that and says, hey, is this something that maybe we have bad information or not up-to-date information on, something that should be changed? So same thing here. If you notice an error or an issue and you report it, it's going to go to a clinician that's going to review it. So I still love that the infrastructure of the UpToDate network and everything that they have built that legacy on is still there, and then that can still be used, and they still have those experts. If you're, I imagine, a startup, it's hard to have hundreds and thousands of clinicians that can review things. So once again, see, there's this little feedback thing. You can like it, you can dislike it. Once again, it's telling me clinical case alert, the things that they're assuming. And so now it's saying rapidly identify and treat septic shock. So now it's a more emergent situation. It's kind of giving me, I need a full sepsis evaluation, additional testing, starting empiric antibiotics, what those antibiotics are, supportive care. Once again, it's giving me the rationale. So now it's more customized to, this is a sick patient. I need to really be thinking about sepsis. I need to be starting the antibiotics. It has that sense of urgency. So that's what I'm feeling. So I love that it's still laid out in a way, and it's giving me a rationale in a way where it's making me think. It's going to make the student think. It's going to make the seasoned clinician think. And it's not just saying, this is what you should do with confidence and you blindly accepting it, because it's very easy to do that, especially for all of us in the ER setting where we have a ton of patients. You want a quick answer. This is kind of giving you that pause of like, hey, I'm giving you the answer. Here's some caveats. Here's the rationale. And you can actually look at everything it's doing. So if you kind of come up here, it says AI generated response, show thinking. It went through 126 steps and it reviewed all of these different sections of UpToDate. It processed them, and then it gives me the answer. So once again, you can kind of look through this and say, once again, they're numbered down here, so that's probably the easiest way to do it if you want to click on it. But if you want to really look through something and then click on it, it'll open it up in a different tab and show that. I don't think they've released it to the mobile app version of it yet. I know that's a plan. At least it's not on my mobile app version, so I'm really looking forward to that, because obviously we're on the go. Usually if I do have a question like this, come out of the patient room, I'm walking to my computer, I'm going to put the question in, and hopefully by the time I sit down at my computer, I have a few ideas of tests I should order or things I should look at and whatnot. Let me see. I had a few kind of questions written that I wanted to ask it. One of them was, I don't see it here, so let me just kind of go back and I'm going to ask it. And this is, I know, everyone's favorite. So I'm going to say 80-year-old female with dizziness coming in. What should be on my differential? And once again, that's a very common thing in terms of, not this example, but we all know why we love and hate this example, just because of how many differentials there are. But I love when you see that rare thing that you maybe haven't seen in a couple of months and you're thinking, I know there's some stuff out there that I'm not thinking about, but I can't quite think about it. I think this is what I love tools like this for. So this is kind of thinking through that, and we'll see what it's doing. The other thing is, a lot of the other tools out there, they're trained on thousands and thousands of papers and studies. We all know that not everything is equally good. And so what studies are they using? And they'll link to them. You can click on them, but in that quick ER setting, or when you need that quick answer, are you going to be able to say, hey, this was a good study that was done with good science versus not? It's just not going to be feasible. And so I love that this is, once again, not trained on the vast amount of things on the internet, because there's a lot of bad things there. This is trained on what is on UpToDate, which once again is that gold standard where we're referring to it. So look at this chart it created for me, and I'm just so impressed by this. So peripheral vestibular dysfunction, central brainstem / cerebellar lesion, presyncope, disequilibrium, psychiatric disorder, medication effects, visual impairment, and it's kind of giving me the common and distinguishing features, and then the test to confirm. And look at how long this list is. And so I love this from am I thinking about this or not, right? Like adrenal insufficiency, amyloidosis, Sjogren's disease. That's not things that are honestly at the top of my differential in the ER, which of course is the nature of the ER. But once you kind of rule out all the emergent things and you're like, hey, it's not a stroke, it's not an arrhythmia, it's not a heart attack, what are other things I could be thinking about? I love that here. And so I'm really excited that we are at the point where mature, reputable organizations like UpToDate and these applications are implementing AI in a safe way. This is, I think, where I'm excited that we're moving to as a space where, hey, we have proved that these technologies are very powerful, that we can sort through tons of data and information and provide guidance to the everyday practicing clinician. But now we're proving that we can do it in a safer way, more reputable way, in a way where I'm going to be comfortable making a decision on it versus, something else out there where, it may look flashy, it may look nice, and I'm not trashing those other apps and programs out there. They're really, really amazing programs out there. But sometimes you don't know exactly what went into the model or what data they're using, or they may be telling you something wrong with a lot of confidence, and no one wants that. So thankful to their team for giving me access to this. Like I mentioned, it's available. They're slowly rolling it out to all accounts. Thanks for watching this episode. I know I'll continue to use this and some of the other tools that I've reviewed as well, and maybe we'll do kind of some flashback episodes to, hey, what do I think of this at the 3-month mark or 6-month mark? But yeah, if you have a tool similar to this or something else out there, I always love playing with them, reviewing them, and sharing my thoughts. If you're at Health next week, I'm looking forward to seeing you out there, and thanks for tuning into this episode.